Hi, my name is Ken. Um, I'm an Australian, but that's not really my fault. I was just born that way. Before my event, I was in my late 50s and had pretty much an ordinary life, I guess. So I wasn't unwell, but I wasn't an athlete either. I mainly worked at a desk job. In my personal life, I didn't do much in the way of physical exercise, except for walking, occasional sport. Um, but nothing too strenuous. Um, so that's why my sort of history is a bit short because it's really nothing that I would have thought would affect me going forward. And my event happened about a year ago, just this week in late September, early October. So this is actually my first anniversary. It's been 12 months since the event. It happened around midnight on a Friday night, and I walked into the bedroom. I started feeling a strong pain in my chest, and I sat down on the bed, and it developed into a burning pain, that went right into my heart, like a sword or a knife on fire had been stuck into it. But the pain was also very weird and not like anything I'd experienced before. So I was a bit scared because I didn't know what was happening. And it also felt stupid and wrong because if it was a heart attack, then um, shouldn't it be a bit more dramatic? Shouldn't things be happening? Shouldn't I at least be in some distress? But sitting on the side of the bed, I just had this pain. And I told my wife, and we rang emergency, and I told them that I was having a heart attack. And they said the ambulance would be on the way, but it was a busy night. And so I should just wait. But my wife pushed me to get out of the house and get to the hospital. And I still thought that I should wait a while, and maybe I was just scared about going to the hospital, um, and trying to sort of just wave off any pain that I was feeling. So, and it just felt stupid to go to the hospital and only to find out that it was indigestion or something got stuck or whatever it was, um, and then have to come home from hospital in the middle of the night. But she pushed me and pushed me some more, and we drove to the hospital. And by doing that, I think she saved my life. And along the way, a lot of scenarios started playing in my head, scenarios that I didn't want to put her through, um, about how she would respond, stuck in the middle of nowhere, on the way to the hospital, um, with no assistance. And eventually we arrived. It wasn't that long though, about 12 minutes, 15 minutes. And I walked into the emergency and across the room, and I said, I think I'm having a heart attack. And someone in a small window told me to go to the triage. And I walked through the doors and I saw doctors and nurses, and I sat down on the bed. And they began to examine me and ask me about my other life factors. What was going on? Did I have any other conditions? But I wasn't a smoker, I wasn't a drinker, I was not diabetic, I wasn't obese or overweight. I regularly have blood tests, lots of checkups, so I could tell that my cholesterol was normal, my blood chemistry was all normal. I had no other contributing issues. They also asked me then if I had family with heart conditions, but no one has any heart or vascular issues. So they did a bedside ultrasound, and they saw that I had an aneurysm of 5.8 centimeters. So almost the size of a tennis ball. And they also found out that I had an aortic dissection. I think they told me, or they told me later, and I didn't understand what it was. But the dissection ran from my heart and up over the top and all the way down into my legs. And they saw that my aortic valve was damaged, and there was also aortic regurgitation. I'm not sure if they told me those things, but I know them now. Later on, when I read my CT angiogram report, they knew that the aorta had dissected into the valve, and this dissection was probably how the root and the valve was damaged. And at that time, and that was early morning now, they measured my aneurysm, which was now at 6.5 centimeters. But as I said, my wife and I didn't really know about what any of this meant. So at one point they said that they had one more test to do. And when someone says that, it's kind of like, well, we have one more test and then you'll be okay. So I sent a message to my family that I'd be going home soon. I'm at the hospital, but don't worry, I'm okay and I'll be there later. Then we were asked what kind of valve I wanted, mechanical or organic valve. And it was explained to me that the organic valve would last about 10 years and the mechanical would last much longer. So we decided to go with the mechanical valve because I didn't want to go through another surgery like what I was going to go through, which I didn't really know or understand, to replace the valve later on. So after a time, not really appreciating the severity of what was going on, we asked if we could think about it and come back on Monday. So of course the doctor nearly hit the roof. He said we have 5 minutes to decide because they were prepping for surgery right now. So I think my story is a little bit like Zach Amber from the Aortic Hope series, where Amber says that she wanted to go home and think about it. But I think the difference is that Amber could see how the dissection could be an issue and might affect her, but I really had no idea what anything was, what a dissection was, or what sort of condition I was in. So we chose mechanical. And then I was prepped and being wheeled along the corridors and on the way to surgery. The surgery was open heart, and I didn't really know that at the time. And it was around 8 hours. And during that time, my family waited in the ICU waiting room for any news. And after the surgery, I went to ICU and I was, of course, heavily sedated. Perhaps even an induced coma, but I had no idea, of course. And my family were convinced that they should go home and recover, including my wife, who had now been awake for over 48 hours. So then about 1 a.m. in the morning, they received a phone call from the hospital that she refused to accept. Eventually, she took the phone, and it was a nurse from the hospital who said that there was a problem. I'd be going back to the operating room. And my blood pressure was 50, and I had clotting around the heart, which made it difficult to beat. It seems that I had a cardiac tamponade, which was a hematoma, which prevented my heart from beating. And so they did another sternotomy, a clot removal, they wired it up and stitched it together, and then moved me back to ICU again. So all up, here's what I had: an aortic aneurysm of 6.5 centimeters, which had possibly grown in the last few hours, ascending aortic dissection, a descending aortic dissection, which went from the aortic root and down to my legs, and the damaged aortic root and the damaged aortic valve. So the surgeons removed the aneurysm and replaced my ascending aorta with a plastic Dacron graft and replaced the valve with a mechanical valve. And they repaired the aortic root, but I still have the descending dissection because I guess that's very long and I may not have many immediate options. So it might be some time before I develop an aneurysm, if I ever do. So I was in the ICU for about 4 or 5 days, which is absolutely the hardest time of my life, I guess. ICU is really hard. And think more about the intensive word rather than the care word. So intensive care unit is very intense. There is noise, there's commotion, excitement, there's distress, all patients fresh from some kind of trauma. So that was difficult. And after about 5 days, I went to the cardiothoracic ward to recover for the rest of 2 weeks. So my sternum was wide closed and I couldn't use my arms much because that would twist the wire and it wouldn't heal straight. So I took a lot of care to make sure that that went well, that the sternum was always aligned and that, it wasn't skewed and it wasn't overlapping, and then I would give it the maximum time and the maximum care that I could. So my tip for anyone having this kind of surgery would be to learn how to cope without using your arms, which was a big thing because I didn't even think about that. And I think we take it for granted because you can't use your arms and the sternum has to fuse together. So we take it for granted that our arms are just there and they're going to be normal, but not having to lift weights and not having to stretch or reach up is kind of a big deal. So I'm going to call out to the amazing nurses at the hospital. Everyone was amazing. One nurse, she pulled the drains from my chest, which is an experience I can't even describe, and I hope to never experience again. So I had 3 drains, and they were pulled out one at a time. And the first that I was ready for, the second I wasn't looking forward to, and the third I was trying to stall and negotiate another time to do it because I didn't want to do it again. But as I said, the nurses are all amazing. I will always be so grateful for the care that they gave to me. So in the ward, I found that I couldn't walk. It was like I had no energy, and I needed to have physio to help me relearn how to walk. And that felt strange because it'd only been a few days, maybe a week, since surgery, and they didn't operate on my legs, so how come they don't work that well? But fortunately, I was walking again, and after a few days, everything seemed fine. So nothing really happened after that. I'm sorry, there's just not much more. It's been a year since my surgery. As I said, my anniversary was just at the end of the Aortic Awareness Month, or the Dissection Awareness. And I guess I'm doing well. I guess the fact that I'm here doesn't show how close I was to not being here. People say that I survived and that I'm a survivor. I don't feel like I'm a survivor because I'm just here being a normal person. There have been some challenges, and I take things slowly, and I'm a bit out of breath sometimes, but largely my life hasn't really changed. And I'm just moving on. I still have the descending dissection, which runs, as I understand, from the greater vessels up and around the top and all the way down to my legs. So I have the descending dissection and heart failure, which are both being medically managed. I have a mechanical valve for which I need a blood thinner to prevent any clotting. I'm taking 5 medications to help improve my heart and the heart failure and to strengthen my aorta because of the remaining full-length dissection. There is some intrusion into a kidney. Fortunately, all my major organs come off the good side of that dissection. So recently I went to have an ultrasound for another reason, I can't remember, but not related. And I mentioned the heart surgery. And the operator asked me, do they know about the dissection? And I said, yes, why? And he said, because if they didn't, I'd be calling an ambulance right now. So that kind of tells me that there's things I need to recognize from now on, things to include in my life, issues I need to consider going forward. I do it now, but some of the things that I've changed becoming commonplace or second nature for me. Just taking it easy, putting shoes on, remembering not to lift things because, yeah, it could put a pressure on my system and it could lead a little further towards something, an aneurysm or a rupture. But I think I just need to take things one day at a time, 1 week at a time, 1 month at a time. And so that's about it for my recovery. I'd like to thank also the surgeons and the doctors and the nurses and the hospital staff. What I noticed was it wasn't really a team that saved me. The surgical team didn't save me. It was like a team of teams saved me. There was hundreds of people involved at every step, from emergency down to my discharge at the hospital. So I have some tips for survivors. For the new survivor, I have 5 tips. So take it easy, you'll get there. Don't rush your recovery. The universe will help you and everything takes time. Number 2, physically listen to your pain. If you're doing something and it makes you hurt in some way, just stop. Don't push through the pain and think you're doing something right or making something stronger or better. If it doesn't feel right to you, then just get help. So I felt stupid sitting on the side of the bed at home that night, and I'm glad I listened to my wife. So number 3 is also to listen to your medical advice. The doctors have seen so many people just like you and me, and they're trained for this. Just listen and take it in. Number 4 is eat well. Don't think we put enough emphasis on eating, but eat well, recover from the inside. Number 5, is talk to people like you, and build networks with them. So I met a few other patients in hospital. Then I approached and said, "Hi, this is my story. What's your story?" We exchanged phone numbers, and now we remain in contact. That helps me, and it helps them, and it helps everybody who has this common story. So I suggest making friends and sharing with them. So for the newly diagnosed, it's a little trickier because I've been told that, oh, I didn't have to worry because I didn't have that much time, or I didn't have that time to worry. But had I known ahead of time about my conditions, then my outcome could have been different. I won't say that it would have, but it could have. I might probably still be here, but I may not have the dissection or as much, or the damaged valve, or the damaged root. My aneurysm may have been a lot smaller. I also have heart failure now. Is it because of the dissection or the aneurysm, or this thing sitting in my chest? So I was 6.5 centimeters. How would I have handled it if my aneurysm was 5 or 4? I think I would have had time, and I would have appreciated that I did. No one discussed with me at the time anything about a will or a power of attorney. I had no visit from psychology or social services. Time was critical, and any of those things would have to follow the will of the universe, I guess. But my point here is that no one really seemed to care about anything except that when time was critical. So if you have time, just think that maybe some people don't have that time. So my advice then is don't panic. I think it's better to know in advance than to not know. Things could have gone so easily the other way for me. We had 5 minutes to prepare, and I guess it could have been different if we had 5 weeks, 5 months, or 5 years even. So I'd have to consider what happened up here as well. It's tough. I went through a severely traumatic experience, and after that, yeah, it's tough. I have so many thoughts about surviving, or what could have happened, what should have happened, what would have happened. All these questions of what if and why. And communicating that to someone who doesn't know isn't easy. But from watching the Aortic Hope Survivor series, there was an episode from Rob Seltzer. So I learned about pump head, and I think I have some post-perfusion syndrome or pump head. A little dizziness, a little wonkiness, I guess, when I'm walking. Sometimes things spin a little and I need to sit down straight away. So Rob sort of told me something that I thought I was going through, but I didn't know how to describe. And it really helps me to watch the Survivor series where other people have shared their experiences. So I'm surprised, but also not surprised that there are so many people with this common connection. Everyone is different, but here we are. I watched recently Martha's story, where Martha says that she's in the 1% club of the 1% club, or something similar. And I describe her as the survivor's survivor. And I think there are about 114 episodes of the Survivor series, and everyone's story Starts the same, but is different. So in the future, I'd like to promote awareness and gather support in Australia and anywhere for aortic dissection and aortic aneurysm. So thank you for listening to my story.
That was
Thank you.
very, very well said. Right away, I want to say hello to the people that we have in the chat. Let's say hello to Molly and Velda and Tom and Katie and Dean. And Molly was on the edge of her seat through this story. She says, "First off, I just love these live Survivor series. Thank you, Ken, for being here." When you started talking about the chest tube removal, she immediately typed in there, "I'm with you, Ken, on the chest tube removal. OUCH exclamation points abound." But then, you circled back around to, and here I am a year out. And she's like, "A year out, you look and sound great. Happy aortiversary." So also very nice. And she wants to share with you that she has very similar circumstances. The heart failure can be reversed. Walk, walk, walk. Right?
Yeah, that's a good tip. That's really good.
And so I wanted to address the ascending, descending part of your dissection. In America, if I'm recalling correctly, in the 1950s or the early 60s, the surgical minds that be decided, our mortality rate for repairing a dissection is abysmal. And they were like, let's repair the ascending and let's put the person back together, give them a little bit of time to heal, and then readdress the descending. And when they started doing that, the survivor rates shot up dramatically. So they don't want to over repair and then cause a longer term probability of keeping you open, having more things for your body to heal with. And so in the descending part of your dissection, it's possible that you have two small tear or openings in the false lumen where blood was flowing and channels back into the normal lumen again. And if that stays stable and everything clots up properly, it'll even heal itself up and you'll be medically managed for the rest of your life on blood pressure. But if you don't see any growth there, then it's good. And we have people in our community, specifically Melissa. She's one of our support group moderators. She's been, I think this is her 15th year with a medically managed type B dissection. Okay. And so just food for thought. It's one of the other things that we've heard in the community here from our doctors is this is the first generation of survivors that we can study. And that's a big thing. That's a very big thing. The idea that it has been missed, we don't have enough awareness, or there's just, we didn't really have the tools to fix these things or the procedures that had a good lasting effect. But now, when you hear about Amber, she's in her mid 30s, late 30s. She's being caught. She's being, saved, and she's I think she's even running again. We have people in the aortic athletes, Jack Crow, who went and ran the New York City Marathon not too long. And if you watch Jack Crow's story, that's a gripping story to hear. But it's about how well your case is going to be on the healing. Walking. Yeah, Molly hit it right on the head. During Jack Crow's story, he was like, how do I get back on my feet? I like to be athletic. What am I supposed to do here? And his doctor said, we're going to do this very slowly. You're going to walk for 2 minutes today. And tomorrow you're going to walk for 4 minutes. And the day after that, you're going to walk for 8 minutes. And eventually you're going to take these small iterative steps until you're walking for about a half hour. There's no need to rush. And I love that part of your message was take it easy. Just pump the brakes. Don't push through the pain. Listen to your body. Those are all very important. Very, very important.
Yeah.
Tom says, Velda says, well done, Ken. And Tom says,
thank you.
Nicely done. I'm glad you're here with us. And I agree. I am glad that you're here with us.
Yeah. So when I look at the statistics, and I guess you do, because I'm trying to work out, I don't know, I guess my reason for being, I guess. And I say, well, the survival of surgery is this, and the survival of hospitalization is this, and the survival of is this. I'm just lucky that I got to the hospital. I'm lucky that I had a supportive wife, um, and she pushed me because I wasn't going to go. And so she drove me, and it wasn't far, but she just worked out everything. I mean, she prepared my home life for discharge after I got out of the hospital. Um, so I guess she's my number one supporter, but I'm going to say, of course she is, but also, yeah. So her and family being great. Um, but I also want to connect with others. And I think this is a kind of way of doing that. And particularly hearing the other people's stories. Um, yeah. So thanks for the opportunity.
No, we love having these stories. In the support group, I have heard about the isolation that one feels. And it happens when you're walking around with an illness that doesn't, you look fine. You don't look like you have a genetic disorder that almost took your life. You look fine. And people, they lose track of what that cost is. You're going to have good days and bad days. Healing can take up to 3 years. We have seen in the community people that they just decide to take charge of their life and they get their sense of adventure back 3 years after their emergency surgery. And it's a balancing act of, again, there is no prescription for what every one of you is going to have to endure after the surgery. And so, speaking of prescriptions, did you have any changes in your chemical makeup that they gave you? Did you have to change any medicines? Did you have any adverse reactions to anything?
Um, no, I think that there was one that they changed shortly after because I attended the heart failure clinic and they did change one of the medications. Um, but I haven't had any adverse reactions to medication. So I haven't had to report that I was out of breath or I was dizzy or I fell over. Um, so I think they just got it right or maybe I'm more accepting of whatever they're giving me.
I mean, the reason for the question is that the side effects that all these manufactured pharmaceuticals have, they're not meant to be endured, right?
Mm,
They have so many of them that you can show up and be like, hey, this one's doing kind of this to me. And the doctor will take that feedback and possibly get you on something that's going to make things easier. But
yeah.
also things such as what time of day you take some medications, right? So, we hear people talking about crashing at 3 p.m. and
Mm,
or having a hard time in the mornings or what have you. And so our one of our people is a doctor of pharmacology, and she was like, you can just adjust the time that you take the medicines. You don't have you have some wiggle room, but you get to find out where in the day these are best for you. And
mm,
so, some of our people heard some of this and they were like, you know what, I should have that conversation. And that's the other real big thing that we want to take from all of the survivors. If you have anything to go back and talk to your doctor about, if you're crashing too much, if you're tired all the time, there might be a thing with your beta blocker that can be looked at, that can be changed,
mm,
whether it's dosage, time of day, or a different medicine that's solving the same problem. But you don't have to endure this, right? And
mm.
that whole I don't know how it is in Australia, but in America we have a white coat syndrome where the doctor says something and that is written in stone and that is how things are going to be. And we don't want to bother the doctors because we know how valuable their time is, and you end up enduring something that you don't have to endure. And so we
Mhm.
tell people to be ready to be their own advocates. You have to self advocate through your entire journey post once you get diagnosed with aortic disease or post dissection. But it's wonderful. And there's two things in your story that are huge here. The big one is obviously you reached out to people and you had somebody to talk to, which really reduces that isolation, right? Because when you're the only one that you've ever talked to that's gone through this, that's got to be massively isolating. And then two, the no adverse reactions to the medicine means that you were getting enough medicine to keep your recovery where it needed to be, and you were getting excellent sleep. How have you been sleeping?
Yeah, I wouldn't say it's, the sleep is, I won't say it's good. I would say that it's enough. Sometimes I feel really tired, sometimes not. I think it's okay. It's sort of okay, yeah, I guess. I take all my medications at night or early evening, and I think it helps to remember them all when I'm taking them. So that's a point too, to keep taking medications. I have a beta blocker. I have a statin. I think the statin's for the remaining dissection. I'm on an anticoagulant for the mechanical valve. So there's a couple of others as well. But taking them all at the same time really helps to remember to take them. But it is so easily forgotten. So been pretty close to, I have forgotten once. I've been close to forgetting a few times.
Yeah, that vigilance. I can hear that. Yeah. We have some more here. Molly says, "Where are you in Australia?" You shared this with us the other day, but there was two of you. One of you was in Brisbane, and one of you was in. Oh, I can't remember where the other one was. Which one were you?
So I'm from Brisbane.
Brisbane. I was close.
Yeah.
Yes.
And I think the other one was from Adelaide.
Adelaide. That's right. Thank you.
If I remember.
Okay. Molly here, she's one of, you've seen her on Week in Review. She's a stand-in, and she's also our social media director. She's also an international flight attendant who goes to New Zealand sometimes once a week. I don't know. She's awesome. LM Sanchez jumped in here to say, "We are here, and thanks for sharing." And I agree. Sanchez, good to see you, bro. Dean here says, "Thank you, Ken. Yes, I almost didn't make it to the hospital because I asked my wife to turn around, but she insisted as we were almost there. I wouldn't have made it another hour." Dean's got an interesting story. And
Yeah, I agree with that.
He's on the way there, right? No, I'm fine. No.
Yeah. I thought about turning around so many times.
Yeah.
Yeah.
Right, and that goes right back to Jack Crow's story, where he's like on the phone with the operator, and he's like, I think I'm gonna be fine. And finally, when she says, listen, no matter where you are, what you're doing, just be prepared to pull over on the side of the road and wait for an ambulance. And that was the message that finally gets through to him to pull off and actually go to the hospital. What is wrong with us men, I tell you? Right?
Yeah. Yeah.
Katie says, "Thanks, Ken."
Well, I just don't want to bother anybody. It's just, yeah.
Right?
Okay.
I hear you. I hear you. So, of all the people that you've reached out to and the connections you have there, are you guys meeting once a little while? How are you keeping up with them?
So I'm looking for a group. I just got some phone numbers of people in the hospital, and so we exchanged texts, but we should meet up, I think. Yeah. Because sometimes out of the blue, I would send a message and they say, "Wow, we didn't expect you to get in contact. This is great." And then we sort of start exchanging how we're doing and where we're up to. Their story's a little different. Some of them planned. A lot of the planned ones, I think you can tell I was in the ward with the cardiothoracic ward. I was with other people who had heart surgeries, and a lot of them have a scar on their leg where they've taken a vein and used that as bypass, I guess, or some other rerouting. And so I could usually spot those. And some others have some very, very serious issues. Diabetes is a complication that I've noticed. Yeah, so I want to remain in contact and find a group. I think there are groups in other cities, but not in this one. And I did ask if there was a group, and the person asked me if I wanted to start a group or that I was asking if there was a group. And I think, I hate to say it, but I think I'm just too busy with everything and more of this. I think I'm too busy to manage a group. I just like to get together and talk.
Yeah, I get that a lot. Um, it is a lot of work. I can tell you, we put in so much work, and we ask a lot of our moderators, right? Like, it's easy if you're, meeting, and what we notice is that it's an ebb and flow thing, right? Sometimes you guys are in great condition and you're willing to give support. Sometimes you're not so great condition and you need some support. The ebb and flow of scanxiety, when your scan's a couple weeks out, all of a sudden you want to get into a support group and hear how everybody's doing, talk about that, or finding out that you have another procedure coming up, and all of a sudden you're like, great, now I'm back to this and I don't want to do this, and that support's big. But the ebb and flow thing is it's a thing. But the moderators, they're there for every meeting, and they're never not thinking about it. So it is asking a lot. But sometimes you have to be the change you want to be, right?
Yeah.
Let's see here. Molly says, maybe I'll see you in Brisbane one day. She does go all over the place.
Yeah, that'd be good. That would be nice.
Oh, you're chatting with her. That's awesome. Right on. Okay, let's see here. So post-traumatic stress, you're already kind of talking about that. You didn't hear anything from a psychologist. Have you done any pursuit of that since?
No, not before. Not. I was literally in emergency, sitting or lying in a bed, and I was like, well, wasn't that I was questioning it. I was just accepting that this is a thing. This is how it goes. Because no one said, oh, you have this, and they're going to do something, and then they're going to do something, and then they're going to do something. No one said that. So I didn't know. So I didn't know what I didn't know, sort of thing. And so later on, it was like, well, if I had more time, then maybe I could have prepared. Prepared before and prepared for after. Because even though my family did quite a lot, there was still a lot of things that I didn't know when I was discharged from the hospital. So I had to sort of learn how to cope. And I don't know how a lot of people would go if they were on their own. And so one of those tips was to just reach out. There are services available. There are paid and unpaid and free services. Things set up to help people exactly like mainly the survivors, the emergency survivors who just don't know what's going on. Did that answer your question? Not really.
It does. It does a good job. How did you approach your physical therapy on getting back on your feet? Did you have setbacks? Any troubles there?
So post discharge, about a month later, I went to a cardiac rehab done by the hospital. That was an 8-week, once-a-week course, which has an educational part and also a physical activity part. So it's good to learn about nutrition, and I learned about things that I didn't have, but the other people did, because it was always like, um, okay, so this is for everyone except Ken, because Ken has got some other things going on. And I'm like, okay. So I learned about stents and various heart medications and thinners. And then it kind of made sense to me that, oh, well, they couldn't have stented my descending dissection. Not not that long. Um, but could they have done something? Maybe they didn't need to do anything. And that was good at the time, and that's still okay. Um, so they they did tell me to walk, and I do walk quite a bit, but find walking a bit of a mental challenge. Um, so I'll get in a busy place, on the street with other people or shopping or just just walking and walking and walking. Sometimes, I don't know, 2 or 3 hours just walking around, not doing anything, just walking. That's good.
Yeah, that's going to be the key for almost everybody that goes through this. They're doing um, the physical strain study right now out of the University of Houston. We have a lot of people in our community that were both on the placebo and those that were given the regimen to follow. And
Mm,
like I said, like this is the first generation of survivors we can follow. Telling people that they can only lift 15 pounds that's not a sustainable answer for younger people, or for how long we're going to be living here now that we have better understanding of nutrition and all of these things
yeah,
that make us just live longer, right? Cleaner air, cleaner water, the whole nine. Everything is going to make us last longer, or at least
mm,
deteriorate slower. Um, but walking is going to be, it's great. It's not just for the physicality of getting out and doing something, but your body needs that motion, right?
mm,
And if you don't use your body, you're going to start to see other problems down the path. And for those
yeah,
of you that are in this community, remember that some of you have an enlarged aorta. Some of you have an actual aneurysm because there's a threshold of a measurement. Some of you have a dissection. And it's not as important where it is as it is to know that there's a possibility that another one can come. And if you're in this world and you know this, do what you can to keep your body weight down for all of the other recoveries that you're going to need.
yeah,
I mean, physical exercise has shown massive, massive benefits for anxiety. So if you can, please walk. And like you said, don't push yourself. Walk as much as
mm,
you can.
yeah. And in the beginning, it was a very short distance. In the hospital, it was down to the end of the corridor. And actually, I think after a few days, my legs and ankles started to swell, because I was retaining fluid. I think once those drains came out, then I was starting to retain more fluid, and I suddenly couldn't walk because my legs just wouldn't bend. Um, so then some fluid medication, and I was okay, and I kept going after a hospital. But now, yeah, I can walk and walk and walk. It's okay. Just not many hills. Hills makes me puff, and yeah, got to
Yeah.
pause going up. Yeah,
And I mean that's for now, right? That's definitely
yeah.
for now. Rob, you brought him up earlier. He was on Matterhorn this past year. He went on a
Mm.
big European trip not too long ago, and he just got back from a
Oh,
driving trip. But yeah, he took some pictures up there, and they're beautiful pictures of him and his wife. And he's one of those. He's one of those. Like, all right, this is it. We're doing this for now because now is what we have. And I think that's beautiful, and I'm glad that he's doing it. And we're lucky to have him on Aortic Kitchen. So, I mean, he's a huge contributor to that. He's also a support group moderator. He gives back. He gives back. Man's got a
mm,
huge heart.
yeah.
Do you have any final parting wisdom that you want to give to these people?
No, just be yourself. Just try to be yourself.
All right. You wanna tell them to like and subscribe and share?
Yes.
Go for it.
Yeah, because if I didn't, I wouldn't be talking now. So get onto the Survivor series. I like the what is it, the breakdown of the patient guide?
Oh yes, I published that on Aortic Dissection Awareness Day this year. Um, when I first got involved with Aortic Hope, it's an interesting problem to solve, right? They're in the walled garden that is Facebook, and people like yourself who are not on Facebook would never be able to
Mm,
find them. But one of the things that is a trouble with Facebook is you have to be logged in to get this information. Well, on
mm,
YouTube, you don't have to be logged in, right? So that's the catch. It's like anybody can see this. We're spreading awareness as long as they have an internet connection. Well, at the time, I had a roommate who I did not know was dyslexic, and reading for him was a headache inducing problem. And so one day he was sharing with me something on YouTube, and it was one of those things where the web page is being read by a robot voice. And it's a funny joke or whatever was in there, and I laughed. And then I looked at him and I said, I could have read this way faster than this. Like, why wouldn't you just send me the thread? And that's when he told me that he's dyslexic and this is how he consumes the internet. And
all right.
so he drops this seed, and it is months later that I meet Karen at Aortic Hope, and I was like, it turns out that there are people who have trouble reading, and if you really want to solve this problem, we want to cut this week in review up and just read everything for them. Well, when we
Yeah.
got to the patient guide, I was like, listen, you want this out there for free, so remember our target audience may not be in the proper state of mind to read. They may be
Mm,
wanting to share this information with their family, so on and so forth. And then to prep this book for the Audible version, we have to chop it into chapters, which also helps because in the event that you have comments or questions about different sections of the book, you can do it directly under those sections. And you don't have to say at the 3 hour mark, this was said, and have people search all over the place. They can just go straight to that
mm.
specific one, drop their comments or questions, and hopefully they'll be addressed. But yeah, Karen did a very good job on that.
Yeah, yeah. That's good. And I like that. Well, maybe like is not the right word, but I appreciate that everybody at Aortic Hope seemed to come from their own issue. So I heard Karen's story recently. And I was like, well, Karen as well. Um, so I don't know the history of Aortic Hope, and I don't know about the people or structure, but I really like the Survivor series. Um, yeah, it's like it's a good feeling. It's like me too. Um, and I just hope things go well for everybody who's put up a video, and everybody else who hasn't. Um, I think there's a lot more. Like I said before, and everyone says this too. Um, it's not a club that we want to be in, but it's good to be in a club, especially this one.
I agree. Now tell them to like and subscribe.
So like and subscribe to Aortic Hope, and don't forget to visit the shop.
I appreciate that plug as well. All right,
It's
everyone. Thank
okay.
you so much. Have a great Sunday for those of us here on the East Coast and the rest of America. We're going into our Saturday nights. Party responsibly, everyone. Ken, you are a pleasure.
Yeah.
It was wonderful to meet you, sir.
All right, and you too. Thank you, Joshua.
Thank you.